Welcome to my show. Let's talk health, Dr. Yash Gulati. Today we have with us Dr. Angeli Misra. She is director of Lifeline Laboratory and specializes in pathology and molecular biology. We will talk to her about COVID tests, when and why they should be done, how many tests should be done, when and why they should be done, what are antibodies, all these things we'll try and get the answers from Dr. Misra. You're very welcome, Dr. Misra. First of all, we know that COVID is raging. So, what are the tests necessary to diagnose this disease? How often they should be done? Who are the people who should be tested? And in a general population, how many tests should be done?
Okay. So the first question is, what is the test? So the gold standard test is the RT-PCR test, which is the gold standard. That is the test which should be done. And the second question is that who are the people on which the test should be done? Now, in an ideal situation, when there is a pandemic, each and everybody should be tested. But that is not happening. So now the people who should be tested are those who are symptomatic. The symptoms may be very minor to major, maybe, just a slight feeling of tiredness or maybe fever or any of the symptoms that we know of COVID. The other thing is that the people who come in contact with a COVID positive patient. Now, what is the ideal time for these people also to do the test? Right after you come into contact, that is not the ideal time. You should do the testing 7 to 10 days after the contact. So these are the people in a situation like ours where we should do the testing. The last question, Doc Saab, that you asked was that what are the number of tests that we should do? Like I said earlier, the ideal thing is that in a pandemic situation, each and everybody should be tested. Belgium has tested 4,960,000 people per million, which is absolutely great. In our country, we are testing some 890 per million, which is not good enough. But Delhi, fortunately, is testing more than 2,700 now recently.
That's pretty good.
And that's pretty good. So the number of testing that we are doing in Delhi is really good.
And what about this? We talk about a rapid test and a slow test, and what is the role of all these?
Okay. So the rapid test or the RAT test, rapid antigen testing, is what is known as a POC testing, that is point of care testing. These are the tests that we do at the patient's doorstep. These are the tests which are done for surveillance. That is, if you have to go door to door, you do testing for surveillance. Now, the problem in the rapid test is that if it is a positive, then we consider that this is a true positive. But if it is a negative, then we have to repeat the RT-PCR testing. Now, why does this happen? Because the positivity rate of picking up COVID patients by a rapid test is as low as 60%. So, 40 to 50% of the people who are COVID positive, we may be missing them. So, we have to test them again with RT-PCR.
Correct. Dr. Anjali, there have been situations, as you know, I'm a surgeon, and I've had instances where patient who has no problem, he just comes for a routine surgery. For example, I remember one patient had come for bilateral knee replacement, came for admission, and we did the rapid test. As you know, we do testing for all the patients who are admitted.
Right.
And surprise, the patient was found positive in that.
Right.
And we had to send the patient back, and there have been many instances like that. Why does that happen? Is it only in asymptomatic carriers, or can there be actually false positive tests?
So, mostly, these are asymptomatic carriers. That is how the pandemic is raging, the word that you used. 80%, 75 to 80% will be asymptomatic. They will have no symptoms, especially the younger people. They will carry this disease and they will spread it. But the other question, can there be false positives? Yes. It's a very, very sensitive test. A part of RNA of the virus is picked up. It is multiplied and tested. So, if that RNA is in the air or the area where the testing is done is not decontaminated from time to time, there may be false positives.
But once it is positive, we have to treat it like positive.
So, the answer to that is that if it is positive and the patient is absolutely asymptomatic, technically each positive should be treated as positive.
So, they should self-isolate and...
They should self-isolate, they should quarantine. But repeat test after 7 to 10 days is advised.
And also, there's been a lot of talk about antigen test, antibody test. We keep reading and hearing about the antibody test is very important if you want to donate plasma. Some people develop less antibodies, some people develop more antibodies. So, can antibody test be used in isolation for diagnosis, or is it a complement to antigen test, or antibody test has some other importance?
So let me tell you very clearly what we are doing when we are testing these things. So when we are doing the antigen test, we are actually testing the presence of the virus. And it is very important for us to test the presence of the virus because that is how we will stop the spread of the disease. Now, antibody testing is the response of the body to the virus, right? So there are two types of antibodies. One is the IgM kind of antibody, which starts early. The response of the body starts early once the virus comes into the body. And then subsequently, there is another type of antibody, which is called the IgG type of antibody, which is a long-term protective antibody. In most viral diseases, like if you see chickenpox, you can see in other viral diseases also such a thing happens. So if the IgM antibody is positive, we consider that this is a recent infection. If the IgG antibody is positive, we say that this is an old previous infection, more than 3 to 4 weeks. The patient is not then considered, does not have to quarantine, does not have to isolate. In fact, the patient is protected, and this is the patient whose plasma, convalescent plasma, can be used for the treatment of other COVID
And
positive
is it
patients.
important as to what is the quantity of antibody that a person has developed? Does everybody develop same amount of antibody, or is it different in severe disease and moderate disease? And what is the minimum level of antibodies for somebody to donate plasma?
So there is a lot of variation on that. Question one is, does everybody develop antibody? Now, antibody is a response of the body to the virus, and different people have different response to the antibody. Now, the antibody does not depend on the severity of the disease. It is actually the response of the body. How much my immune system is responding to this virus. So, it does not correspond to the severity of the disease. It is the personal response of that patient, right? Now, the second thing is that some people are good responders. Some people are in fact non-responders. They will have no antibodies.
So does that mean they will not be able to fight the disease then?
So they do fight the disease. Fighting this disease, antibody is not the only. So there are two methods of fighting. One is the cell-mediated immunity, which is the cells will fight the virus. And the other is the antibody. They will still fight the disease, but the method of fighting the disease is different. And that cannot be quantified.
Which one is more important? Is this the AK-47, the antibody, or the cell-mediated is more important?
They are both work hand in hand. They work hand in hand.
Okay, so these are one a grenade and a rifle against
Correct.
the virus.
And it's a team, it's a whole army that is working.
Great.
Through.
And how long does the antibody stay in a person? And can a person donate blood forever or plasma forever, or is it a limited time that you can donate plasma?
So recent literature has shown that after 3 months, the antibody starts depleting. So 3 months from the time of getting the COVID infection to 3 months is the best time that one is protected and one can donate the plasma. After 3 months, some people will continue to have the antibodies, and in many cases, it will dwindle. And it comes in about 6-7 months. We have also known that people come to almost zero.
So does that mean that the person also loses immunity against the disease with time?
That is a very, very significant question, Dr. Saab. This is still being researched. There are cases of reinfection that we know. People are being reinfected, and it is presumed that once the antibody titer is zero, that people have the chances of being reinfected. However, this is not so simple.
Dr. Misra, I have observed in many instances, people who have gone through COVID, they think, oh God, I'm fine, so I can never get infection again, and they stop taking all precautions. So I think there is a message to them also that we still do not know whether reinfection is possible or not. We know that the antibodies dwindle. with time whether they will again become prone to infection or not. So it's better that everybody takes universal precautions.
Correct.
Whether somebody has gone through this disease or not, or whether somebody has not suffered or suffered, we should take precautions. Dr. Mishra, you have given us very great answers, and I think our audience will benefit a lot from your talk. Thank you very much for coming here.
Thank you, Dr. Gulati, for having me here.